Hello everyone. Today we will be discussing in detail about the management of hand fractures with Dr. Parag Lad, who has been consultant hand surgeon for last 14 years at Pinnacle Ortho Centre.
Thank you, ma'am.
What are the commonest causes of hand fractures?
Hand fracture is one of the very important organ. In fact, hand is one of the very important organ in human body. If you see after my face, the only exposed organ at present is hand. And that's why it is most prone for injuries. The commonest causes, it depends right from accidents, right from playing sports, right from domestic injuries in women who handle grinder machines, right from industrial accidents where people or laborer handles machines to work on a metal or any glass cut injuries, as well as most common causes sometime is playing cricket, especially people play cricket, sports. So in a nutshell, sports injuries in adults, then machine injuries in laborer class or people who are working on a machine like an industry, and in women mostly domicile injuries like household activities, even kitchen work while cutting some vegetable or while operating mixer or a grinder machine.
Okay. So how the hand treatment is different from the other parts of the body?
Very important question. Apart from the hand, like if you say thigh bone fracture or a arm bone fracture or a hand forearm bone fracture, here there are lot of muscles, lot of skin and soft tissues. But in hand, there are no muscles and the organ is very slender, very slim and trim. So the treatment remains different because if you don't treat this properly, the commonest problem that any patient will face is a stiffness in the hand if you don't treat this properly. Second is immobilization. Somebody gets a fracture. If somebody gets a fracture around elbow, you can use cardboard, you can use wooden plank and support it. But somebody gets an injury in the hand, very less likely we have something to protect. The third important thing is, apart from hand, other bone fractures are less commonly have open injuries. But hand, as I told you, the most exposed organ of human body, sometimes open injuries or crush injuries are extremely common. So to summarize, how hand fractures are different from other bone fractures, because of less volume of muscle, these fractures are very notorious and they are very difficult to treat. Second is, one single digit has got 3 joints, 1, 2 and 3. Right. That's why one fracture can give stiffness into one finger, and one finger stiff can give or jeopardize the entire function of the hand. That's why if here one bone is fractured, this bone is affected. But here, if this joint is fractured, all 4 fingers will get affected if you don't treat it properly.
Very crucial.
Yes.
So what is the primary treatment that we can suggest for hand?
So let us take example. Any woman getting an injury in a kitchen while working as the household activities, if the injury is not open injury, it is just a closed injury, she has to just put ice packs. And nowadays we eat ice cream, so there are ice cream sticks. You put an ice cream stick and just tape it with the band-aid. If there is a problem in the finger, if there is a problem in this part of the hand, you can just take a newspaper and wrap with your dupatta or a crepe bandage and just protect it from here to here. Make sure that anything that you wrap around the hand you should not make it very, very tight, because that will stop or reduce the blood supply to the finger. If somebody gets this injury on field or like a sports injury while playing cricket, outdoor activities, then usually they must have one therapist or one healthcare provider with various splints. So at Pinnacle Ortho Centre, we keep all the splints ready. What does splint mean? It is just a ready-made support which has a Velcro strap. If you don't have anything, ask the patient to keep the hand on the shoulder and rest it like this. This is the best way to immobilize or to give primary treatment to the hand. Just keep it vertical. Right. The purpose is the swelling does not come, and whatever swelling or bleeding has happened, it will flow down,
Down.
and the finger will become better.
Okay. Sir, do all hand fractures require surgery?
Very good question. No, never. There are only three important fractures in the hand. Any fracture that is occurring at the joint, because we want early movement, we require surgery. If the fracture is at the shaft level or away from the joint, usually simple taping of two fingers with strap or band-aid is sufficient.
Okay.
If the injury is open injury or crush injury, where important nerves, tendons which are responsible for movement, if they are open, to prevent infection, they need surgery. Some of the hand fractures, which we doctors will tell you that this is a hairline fracture or this is a very mild fracture. But whenever we are asking a patient, whenever somebody gets a hand fracture, if a patient is able to make a proper fist, then they don't need. But while making a fist, if the finger deviates on this side or this side, that is in medical word we call a malrotation.
Correct.
Those patients will need surgery.
Sir, how should we consider or treat open or crush injuries in hand?
Okay. So first I would like to clear one small myth that any open wound or bleeding which occurs at home, we first try to put turmeric or haldi. Some people put chuna. Okay.
Yeah.
And they tightly bandage it, or they apply lot of pressure and make
to stop the
bleeding. This is my first message to all audience who are listening this video. Never put any household objects like turmeric, haldi, chuna on fingers. Never ever put that.
Okay.
It will work like an antiseptic, but if God forbid that patient needs a surgery, the chuna or haldi, it gets stuck to the nerves and tendons and bone so tightly that for a surgeon it is very difficult to remove, and that causes more infection rather than stopping the bleeding.
That's what 90% of the patients do.
So do not apply any household remedy or kitchen related products on the finger on an open injury. The second is, if the bleeding is not very active, just hold the hand 30 seconds under tap water so that the direct contamination load, the direct bacteria load is reduced by 90%.
Okay.
And the third important thing is, just try to apply some antiseptic ointment and just wrap a very loose dressing. And as I told you before, just ask the patient to keep the hand up. The bleeding will reduce significantly.
Doctor, what are the red flags or warning signals in hand fractures?
Yes, this is a very important question, because most of the patients, when they get first injury, especially when the injury is closed, means if there is no bleeding wound anywhere, they don't visit doctors immediately, because anybody who has an injury will try to look whether my fingers are moving or not. Then they usually don't go to doctor, and they go to doctor when they realize that certain movements are just not happening. Okay. Probably by that time you are too late. So my first suggestion is, just reach out to doctor in first 48 hours and make sure that your judgment is right. The second warning signal or a red flag, what we call, that in any injuries, if the fingertip, pulp of the finger, if that is not looking pink as compared to other hand or other finger, means if it is looking dusky red, black or green, you have to reach out to doctor. That means it is not a problem of a fracture. Probably the blood vessel or there is a gangrene that has begun. Second important warning signal is, just try to check sensations in the pulp. How do we do that? Just try to hold a cold water glass or a hot water cup. If you feel your finger is numb or you don't have much sensation, you have to reach out to the doctor immediately. And the third important sign we call a compartment syndrome, where if you feel your injury was not very serious and you still have excruciating pain, which is unbearable, even after taking any painkiller or tablet, if the pain is not subsiding, that is the most earliest sign where you have to visit your doctor as early as possible
without delay.
without delay. So pain unbearable and in proportionate to your injury. Some people just have a trivial fall, just a minor fall, and after 2 days their hand becomes very much swollen and they have unbearable pain. That is the first sign you should go to a doctor. And the second, as I told you, if the color of the fingertip is not pink, you must visit a doctor. Third important thing, as I told you, if the sensation at the fingertip is not proper, please visit your doctor. And the last and most important in fracture, if there is a malrotation. If I am making a fist